Hello, my name is Ricardo. I'm a student nurse, and the purpose of this video is to illustrate how to insert an IV following policy and procedure. Notice that I'm wearing an N95 mask in compliance with COVID-19 protocols. I'm wearing my ID. I'm also wearing gloves, which is the required PPE for this procedure. Before I proceed, I'm going to verify my patient's name and date of birth. I have a patient by the name of Katie Vasquez.
Yes.
Date of birth June 6, 87. Is that correct? Okay. Now, while I'm doing this, notice I also make sure that the bed is in the lowest setting, that the cot line is within reach, that the patient is aware of this, and that the locks on the bed are engaged. Now, before I proceed with the procedure also, I need to make sure there are no medication allergies, no known allergies on the patient. Do you have any medication allergies, Ms. Vasquez?
No.
No? Okay. Any allergies to the antiseptic solutions that we're going to use?
No.
Okay. Do you have any questions before we proceed?
No.
Okay, thank you. At this point, I'm going to go to my med room, access my MAR, draw the medication that's ordered for this patient, compare it against my MAR. That will be my first med check. I'm going to read the medication and my MAR to the chair side, compare it, verify my name and the patient's name and date of birth again, and also verify the 6 rights of patient, right medication, right dose, right time or frequency, and right documentation. Once I've already verified that, I'm going to proceed to initiate the procedure. I'm also going to review the equipment. I have my flush with my connection tubing already primed. I have it here. I have my IV, which in this case would be 20 gauge. I have my antiseptic solution and a gauze in case there's needed. I also have my tape that I'm going to use, and it's all in a blue pad, ready to use. I'm going to position at this point the patient's arm, like so, and I'm going to apply the tourniquet so I can locate a vein that would work well for this procedure. Okay, now that I've done that, I'm going to proceed to disinfect. Once in a vertical motion, second time horizontal, third time using the bullseye technique. Now I'm going to allow that to air dry while I get rid of any extra supplies. Okay. I'm going to apply the tourniquet again. I have to keep in mind that the tourniquet should not be left on the patient's arm more than a minute. Once I have the tourniquet, and I've already located my vein, I'm going to advance my IV while also retracting the stylus on it. Once I've done the cannulation correctly, I release the tourniquet, secure my IV, press on the vein so I don't have any spills, and at this point I'm going to connect the tubing to my IV. Once I have that, I'm going to flush the IV. I'm going to ask my patient if there's any pain, any burning, any sensation, nothing. I'm also going to monitor the arm, make sure there's no swelling. We have any pain? Is there any pain there now? No? Everything's fine? Mm-hmm. Okay. Now, I'm also going to connect my tubing now. I'm going to do my butterfly taping, secure my tubing, and cover it with a Tegaderm dressing with my name, date of birth, and the time that the dressing was applied. Once I have that, I can proceed to administer the medication. I'm going to remove the flush, clean the port, Put in my medication, administer at the rate that the medication is indicated. Once I've administered my medication, I'm going to remove it, disinfect again, and lock it with a saline lock. Okay? At this time, I will also provide reassurance and education to my patient and ask if there's any questions. Patient denies any questions, any concerns at this point, so the procedure is complete. Thank you.